Senator from Delaware.
Mr. President, I've come to the floor tonight to join my colleagues in opposing the Senate Health Care Reform Bill, what I'll call the Senate Trump Care Bill. I'm also here to thank the thousands of my constituents, the thousands of Delawareans who've called and emailed my office to express their opposition to this bill that is neither about health or care. It's because of your efforts, because of the efforts of thousands of Americans across the country who've made their voices heard, that the Senate doesn't today have enough votes to pass this Trump Care bill. And I urge everyone watching and listening to remember that this fight is not over. The Senate will be back next month, and Republicans will be doing everything they can to make tweaks or shaves or changes or amendments to the bill to get it past this body. And we need the engagement, the persistence, even the resistance of Delawareans and Americans to make sure that the Senate Trump Care bill never becomes law. This is as urgent now as ever because of how fundamentally heartless this bill is. As many nonpartisan organizations, including the Congressional Budget Office, have pointed out, this bill is essentially a massive tax break for the wealthy, paid for on the backs of some of America's most vulnerable citizens. Many of my colleagues have already discussed the devastating impact this bill would have over time on millions of Americans. This Senate bill would make hundreds of billions of dollars in cuts to Medicaid. It would slash tax credits that help Americans buy health insurance, and it would force 22 million Americans off their health insurance and drive up costs for many millions more. If that's not bad enough, the Senate Trump Care bill does all of this slashing and cutting in large part to give another tax break for our wealthiest citizens. If this bill becomes law, the very richest Americans would get an extra $700 billion in tax breaks over the next decade. Now, if it only affected the millions of Americans who depend on Medicaid or who purchase insurance on the individual market, it would be unconscionable, but it's even worse. Let me explain. Many of our constituents don't realize that even Americans who get their health insurance through their employer, the 150 million Americans who get their health insurance through their employer have benefited from the Affordable Care Act. In fact, I think in some ways the consumer protections put in place by the ACA is the most important accomplishment of that bill. A core requirement of the ACA was that all health insurance plans cover what are known as essential health benefits. These are basic services like emergency care, prescription drugs, pediatric services, maternity and newborn care, hospitalization, health care for the mentally ill, and substance abuse for the addicted. To put it more succinctly, these are all the reasons many people want health insurance in the first place. Thanks to the ACA, almost every insurance plan in the country today has to carry these core services. That includes the more than 150 million Americans and the 500,000 Delawareans that get their health insurance through their job. The Senate Trump Care bill would allow states through waivers over time to gut these essential health benefit requirements, gradually making many Americans' health insurance less and less valuable and less protective of their health and their families. That provision of the Senate Trump Care bill would also allow states to waive the ban on insurers imposing annual and lifetime limits on essential health benefit coverage. That means that even if you get insurance, good insurance, through your employer, if you have an unexpected development, let's say the birth of a child prematurely who develops serious medical challenges, or a terrible diagnosis that requires expensive and repeated surgery, you either have to come up with that money on your own or you're forced into bankruptcy once you hit the lifetime cap. Let me demonstrate with an all-too-real example. About 1 in 10 newborns have to spend time in the neonatal intensive care unit, or NICU, after they're born. And according to the American Medical Association, in the NICU, quote, "it is not unusual for costs to top $1 million for an extended stay," unquote. That means even a baby born to parents with great insurance coverage through their employer hit their lifetime insurance cap before they even leave the hospital for the first time. And as Americans are scrambling to find ways to pay for their astronomical out-of-pocket costs under the so-called Senate Trump Care bill, wealthier Americans and corporations will be given big tax breaks. Moreover, while Senate Republicans may claim their bill does still cover pre-existing conditions, insurance under this bill would be rendered meaningless if it doesn't cover what you need to treat your pre-existing condition through these essential health benefits. So, Mr. President, let's briefly recap this Senate Trump Care bill. Millions of Americans lose health insurance. Those who manage to keep it end up paying more but getting less coverage. And the wealthiest Americans get another big tax break. That is a painful, even cynical political calculation. Mr. President, since I came to the Senate 7 years ago, I've said more times than I can count, I want to work with Republicans to fix the parts of the Affordable Care Act that need fixing. Let's simplify the reporting requirements that burden small businesses and increase the tax credits that help small business employers offer insurance to their employees. Let's find ways together to increase competition and expand the tax credits to bring down premiums and deductibles on the individual market. Let's explore new mechanisms that control health care costs by incentivizing reforms and producing healthier outcomes rather than more tests and services. Sadly, this Senate Trump Care bill does none of these things. It is my hope that after today's developments, that after the next few weeks, that after hearing from their constituents and returning in the next month, that my colleagues will recognize that if we work together, we can address the broken parts of the ACA and sustain the best of what it's done to expand insurance and health care for millions of Americans. Let me close with a story that I shared earlier today on the steps of the Capitol. This is Carrie Orr. Carrie's from my hometown of Wilmington, Delaware. Carrie's a massage therapist, a self-employed yoga instructor, and like many Americans, she considers the Affordable Care Act, and I quote, nothing short of miraculous. Carrie signed up for health insurance in 2014 thanks to a subsidy that made it available to her through the ACA. She'd had some nagging abdominal and lower back pain for years, but didn't think much of it, considering she had no family history of disease and had never even had stitches before. But that next year, in January of 2015, a routine procedure covered by her new insurance, which she told me she wouldn't have even gone for if it hadn't been covered by this new health insurance, revealed that Carrie, in fact, had stage 3 colon cancer. She had surgery a week later, she had 6 months of chemotherapy, and she ultimately faced no out-of-pocket expenses and was fully in remission. Carrie's cancer has now been in remission since that September of 2015. And as she wrote to me earlier this year, quote, the ACA came along at the last possible moment that it could have saved my life. I'm certain without it, I would have continued to just live with the discomfort and try to self-treat until my cancer was so advanced it could not have been treated. I'm opposing the Senate Trump Care bill for Carrie and for the thousands of Delawareans and millions of Americans just like her. I've heard stories from Delawareans about things that need to be fixed in the Affordable Care Act, and I hope I get a chance to work across the aisle to do that. But I've also heard from hundreds of Delawareans whose lives have been improved, or in cases just like Carrie's, saved by the Affordable Care Act, and I will not yield on defending the best parts of the ACA that have saved the lives of Americans across this country. In the days and the weeks to come, I hope all Americans will stay active, stay engaged, and stay on the course so that we can push aside this cruel, cynical bill and find an opportunity to work together on a bill with real heart. That fight is not yet over, and I will not yet yield. Thank you. And with that, Mr. President, I yield the floor.